So what factors affect health? So we're returning essentially to that question we began with at the start of this video. In this last section of the video, we will spend some time examining some of the determinants that shape health and health experiences. And there is a multitude of factors, some of which are listed on screen. For example, where you live, whether you live in a metropolitan setting or in regional or rural Australia. The state of your environment, so this can refer to things such as overcrowding or your living conditions. Your income, which is referencing, of course, socioeconomic status. Genetics, so keeping in mind in the biopsychosocial model, we haven't completely abandoned biological causes of disease, but we're trying to embed them within a more complex understanding of phenomenon. Level of education, relationships, and access to health services. So in the next few slides, we're going to speak to some of these in a bit more depth. Income and social status. Higher income and social status are linked to better health. Likewise, lower income and social status display poorer health outcomes. Education. Low education levels correlate with poor health, increased stress, and decreased self-confidence. What do we mean when we talk about the physical environment? We mean, we're referencing here, for instance, access to safe water and clean air, healthy workplaces, safe housing, communities, and roads. People who are employed are generally healthier, particularly those who have more control over their working conditions. So a note here, physical environments can refer to where you live and also where and how you work and how you transport between various facets of your life. Social support networks. And this is a key variable in my research. So I'm a PhD student and I'm looking at the social support experiences of trans and gender diverse adults. Why I'm looking at social support is it's a key determinant of health and well-being for humans. We are social beings, social creatures. And we know that greater integration within social networks and perceived availability of social others, so how well you feel supported by, for instance, your family, your friends, your partner, your partners, is associated with better adjustment to and recovery from chronic disease, and in fact is associated with longevity, so how long you live. So people who rate their social support experiences more highly than other people also typically rate their health and well-being more positively. So in short, we're social creatures, and social integration, feeling connected to others, feeling like you belong, is really important for health. For those stuck to think of a topic for your first assessment piece, looking at the effects of social isolation on the health and well-being of adults during COVID-19 would be a really timely and interesting piece. Feel free to discuss this with me later. And again, as I mentioned, when we're talking about the multiple determinants of health and the complex interrelation between them, genetics is still part of that when we're adapting or using the biopsychosocial model of health. So inheritance plays a part in determining the lifespan, healthiness, and the likelihood of developing certain illnesses. Personal behavior and coping skills, for example, what the type of foods that you eat, the type of lifestyle that you have, all affect health. And specifically, they impact kind of predetermined factors of health, such as genetics. Sex and gender are important determinants of health. Sex-based differences are important to consider. For example, I have a student in one of my classes who's particularly passionate about endometriosis. So endometriosis is a health condition that will only affect women. How you are socialized is also important. So being socialized as male or female impacts your experiences of life. I'm going to focus here in the next few slides on the experience of gender diverse youth as an example of this. So in 2018, 859 trans and gender diverse young people in Australia who were aged between 14 and 25 completed a series of questions, so a survey on their experience of life and their experience of health and well-being. The results and the association with health outcomes were really quite confronting. So in this study, which was entitled Trans Pathways, we see some pretty alarming results. So 89% of trans youth in Australia who were sampled had experienced peer rejection, and 74% had experienced bullying. Almost 80% had experienced issues with school, university, or TAFE. almost 70% had experienced discrimination, and well over half experienced a lack of family support. So before I mentioned social support as a key determinant of health, for trans and gender diverse people, family support is quite rare, and as we discussed earlier, this is a key and fundamental determinant of health. So based on this risk portfolio, it's not surprising that we observe some pretty alarming health outcome statistics from this survey. Perhaps the most well reported is that almost 1 in 2 trans young people have ever attempted suicide. So that's not even suicide ideation, that's suicide attempts. 3 in 4 trans youth have ever experienced depression, and almost 3/4 have also experienced anxiety. So this is an example of how sex, gender, patterns of socialization, and social norms around the expression of gender have incredibly profound and significant effects on the health of the population. Health services. So access to and use of services that prevent and treat disease has an influence on health. I want to be a bit more critical in a presentation of information here. Just because health services exist doesn't mean you will feel safe accessing them, nor does it guarantee that your experience of doing so will be acceptable in terms of, for instance, non-discriminatory practice. This is something that we would discuss in our subsequent discussion of the health of Aboriginal and Torres Strait Islander Australians later in this unit. Okay, so I thought I would introduce a reading for this week that has great relevance to the COVID era in which we are located. I don't know about you, but my suburb has just gone into lockdown, so COVID-19 is very much at the forefront of my mind. In closing, I want to present the second activity for this week, which is to read the article on screen, which is entitled COVID-19 Unique Public Health Issues Facing Black, Asian and Minority Ethnic Communities, which is often referred to using the shorthand acronym BAME. I would like you to read this article on screen and answer the following questions. So these questions will appear as a discussion or activity thread on Canvas. First question, I'd like you to list the biological determinants of COVID-19 risk in BAME communities. Secondly, I'd like you to list the social and cultural determinants of COVID-19 risk in BAME communities. So essentially what I'm getting you to do here in a way is to compare and contrast how the biomedical model may interpret disproportionate risk of COVID-19 in BAME communities with that of the biopsychosocial model that would also approach this question. So they're the first two questions. List the biomedical determinants or biological determinants, and list the social and cultural determinants. And the third question is one where I'm really challenging your critical analytical skills here. And because the exam will be conducted online, most likely, we're going to introduce more nuanced questions such as this third question, which is, what would be lost if we focused only on the biological determinants of COVID-19 risk in BAME communities? So feel free to jump across to the discussion board where you will find these questions written as activity 2.2 and have a go at answering these.